Suleika, you touched on it, but maybe you could talk a little bit more about how you made that decision to opt for fertility preservation before you started your treatment.
I think it became pretty clear to me earlier on that my goal for myself wasn't just to be cured, but to have a certain quality of life. I say this a lot in different lectures that I give, but I really believe that health is about adding life to years and not just years to life. That was something that was really important to me. I've always wanted to be a mother. I've always imagined myself having a big family one day, and it was very clear to me that that was something that I wanted to do. To go back to the issue of the financial barrier that a lot of patients face when making that decision, I was fortunate to be connected to several resources by my doctors and a social worker, primarily Fertile Hope, which gives grants to help cover the costs of egg and embryo freezing for cancer patients. And then once I had done that, I was connected to something called Verna's Purse, VERNA, that helps cover the cost of long-term egg freezing, which can be very expensive. So I have about 11 eggs somewhere in a freezer in Minnesota, which can feel kind of surreal to think about.
Right.
But it does give me a lot of comfort to know that they're there and that I'll at least have the option of trying to have children of my own one day, even if the egg freezing doesn't necessarily work.
Right.
And really what it taught me, I think, most of all, was that I couldn't just be a passive patient. I needed to educate myself and to inform myself and to advocate for myself, because no matter how brilliant and well-intentioned my medical team was, they didn't always know what was important to me and what was my priority. Every patient is different, and it was a lesson for me in speaking up and asking questions and doing my own research.
I guess a question for you, but maybe also the doctor, was there any talk or discussion about if your fertility were to be impacted, any discussion of adoption opportunities later in the future, or that that's something you should or could consider?
Unfortunately, adoption is still a big challenge for cancer patients. A lot of adoption agencies won't adopt out to individuals who have a history of cancer, no matter how far out they are from their treatments. It's something that I don't know a lot about. I know there are a few adoption agencies in the U.S. that focus specifically on working with cancer patients to help them adopt children. But that's something that I think has come as a surprise to certain friends of mine who didn't freeze eggs or embryos and then went to try and adopt and weren't able to do so because of their medical history. Yeah.
Interesting. Doctor, is there any sort of, it sounds like that maybe what the conversations that you have with your patients and your research is a little bit unique, that it's not common for oncologists to have this conversation with newly diagnosed patients. Is there any change in how doctors are being trained or their interaction with patients where this is becoming more of a common discussion point?
Absolutely. I think that we are seeing both in the reproductive endocrinology and infertility fields, there is a big interest in research for fertility preservation. And we're starting to talk with oncologists more about that as well. Oncologists as well are becoming more educated in this process, and or if nothing else, just referring to us on a more regular basis to discuss this with their patients. We recognize that for them, they have a lot of other things to talk about, and given that this is more our field, they will typically refer to us so that we can explore those options with the patients. And since 2006, it's actually been recommended now that they have this conversation and document that there is a possibility, or what the possibilities of infertility would be based on that patient's treatment plan, and allow the patient that option to have a consultation if need be. So, and certainly I think, whenever I meet with these couples or when I meet with women, it's important to consider all the options. And like Suleika talked about adoption, I mean, certainly that can be a challenging route as well, with, no guarantee and a time delay and many costs. But there are other options too. And certainly if egg banking or embryo banking is not an option before, and cancer treatment has already occurred, then women can choose to even look down routes using an egg donor. In other words, eggs from another woman, whether that be an anonymous woman or a family member, or even a donor embryo, which would be an embryo already created through the process of IVF, which could then be, carried in a pregnancy. Or if it's felt that that woman would not be able to carry a pregnancy for different reasons, whether it be unsafe or not possible, she could use what's called a gestational carrier, or someone to carry that pregnancy too. So there certainly are a number of options available today, and I do think that we are talking more and more with patients about it, but certainly there's a lot of room for improvement still to go.
Mm-hmm. Thanks. Suleika, I mean, you're obviously in a pretty good place right now in terms of your cancer, but was there ever a time when you were, really in the middle of it all that you thought maybe I shouldn't have delayed treatment, or do you think delaying treatment for a couple of weeks to do fertility preservation impacted your outcome at all?
Honestly, that's not something that ever really crossed my mind. The first few months of my treatment, and certainly after my bone marrow transplant, felt very touch and go. But I think, if anything, knowing that I had those eggs gave me a sense of hope for the future. Mm-hmm. I think one decision that was really difficult for me was the decision between eggs and embryos. And I was in a relationship at the time that I'm no longer in, and we had felt very strongly that we wanted to go the embryo route, and the social worker very strongly cautioned us against that, because I was so young and because we were in a new relationship. And I think that's a really difficult and personal choice. Now looking back, of course, I feel relieved that I didn't create embryos. And now I can understand the many different ways, legal and personal, that can become complicated. But I still think it's a really difficult situation to be presented with, because when you are taking that time and delaying treatment, you obviously want to go the route that's most likely to be successful. But there are so many other things to weigh when making that decision.
Right. It's impressive that you were able to be your own advocate and put thought into it, because it just seems like when you're diagnosed, it's just kind of a whirlwind of stuff, right, and a lot of fear, and it's just like, well, I need to get going right away on my treatment because you don't really know what's going on. But it's like I said, it's very impressive that you made those decisions early on?
I think for me it felt like the only concrete thing that I could wrap my head around. Cancer was something I knew very little about. None of my friends had been sick, and fortunately no one in my family has had cancer. But motherhood and creating a family, that was something that I had always assumed would just be an option at the very least, and a decision I could make for myself. So I think in terms of advocating for myself, I didn't even really see it as advocacy. It was just a very strong guttural reaction that I had where I said, I need to at the very least have a conversation about this with my doctors. And I think that's something that's really important, even when your medical team feels that you can't take those 2 or 3 weeks to do egg or embryo preservation. But I think it's a human right to at least be informed of what may happen to your body.
Right.
Absolutely. And just to echo, if I may echo what Suleika said, I think that it's when patients are given the cancer diagnosis, they have so many things on their plate typically, so many doctor's appointments in a very short period of time, so many, things to consider, let alone considering how serious their relationship might be at the time, like Suleika had talked about. It's truly overwhelming, but I think that we owe it to patients to at least have that conversation and let them know what their options are. And I have some patients that have realized that there's just too much on my plate, and I don't want to devote any energy to my fertility right now, but I'm really glad I at least understand and I can make an informed decision about that. But right now, I just need to focus on cancer. And there are other patients who feel completely the opposite, who say, this is more important to me than some theoretical risk to my prognosis, and I would rather undergo some type of preservation first. And so I think, being able to have that conversation is helpful no matter what the outcome is and what the patient decides, that they go into it feeling like they have some control in a situation that is very much out of their control at that time.
Mm.
Right. And I think, Doctor, what you just said about a theoretical risk, I think is really important, because I think you don't really know what the risk is or isn't, or what your success is going to be with your treatment or not. So I do think that you're both right. You need to go with what's important to you and follow that path.
Yeah, I think it's, certainly I'm not an oncologist, and I defer that conversation about risk to them always. But a lot of it comes down to patients too, and some patients are willing to undertake that risk and say, I'd rather look back and know that I did this, even if it has some consequence. And other patients don't feel that way. They don't want to take any possible chance that may affect their prognosis. So it's really, again, that's a conversation between their oncologist, but it's still important for them to understand their options.
Right. Okay. I think that's it for the questions that I have, but I'm pretty sure Priya has a whole bunch of questions from some of the listeners or registered participants.